tomorrow. Scare tactics, stall tactics. RNC Chair Michael Steele's strategy for attack on the president's health care reform effort.
He's conducting a dangerous experiment with our health care and with the quality of our lives. All of us should be scared to death. So slow down, Mr. President.
The president's reply, seek immediate professional help.
We can't afford the politics of delay and defeat when it comes to health care. Not this time, not now. There are too many lives and livelihoods.
Want to hear why the hardest thing to do in American politics might finally happen this year, even though it's never happened before? Check it out.
If we're able to stop Obama on this, it will be his Waterloo. It will break him.
It will break him. It's Republican Senator Jim DeMint of South Carolina, presumably trying to rally conservative activists to oppose health care reform on a Friday conference call. What he actually did, of course, was give the White House all the ammunition they need to portray the opposition to fixing health care as a political goal that has everything to do with scoring points against Democrats and nothing to do with what's right for the country.
Just the other day, one Republican senator said, and I'm quoting him now, "If we're able to stop Obama on this, it will be his Waterloo. It will break him." Think about that. This isn't about me. This isn't about politics. This is about a healthcare system that is breaking America's families, breaking America's businesses, and breaking America's economy. We can't afford the politics of delay and defeat when it comes to healthcare. Not this time, not now.
On the Republican side, there isn't yet a counterproposal on the table. So the fight is not about what to do about health care. Right now, it's about whether or not we should do anything at all. The Republican Party chairman today gave a press conference in which he said that plans to reform health care were socialist, and then he said he wasn't prepared to actually talk about health care policy at all. His exact phrase was, "I don't do policy."
Do we support requiring individuals to get health coverage? Again, that is one of those areas where there's different opinions by some in the House and the Senate on this. And look, I don't do policy. I'm not a legislator.
I don't do policy. I'm just here to do a press conference about health care policy. Why are you asking me about policy? What is this policy anyway? Mr. Steele also managed to miss the news that Harry and Louise, the TV ad couple who helped kill health care reform 15 years ago, are now actually for health care reform.
Harry and Louise helped save us from Hillary Clinton's health care experiments in 1994. This year, Harry and Louise have been replaced by another couple, Harry Reid and Nancy Pelosi.
Actually, it's not the 90s anymore, and even Harry and Louise know it.
Well, it looks like we may finally get health care reform.
It's about time, because every day, more and more people are finding they can't afford health care. A little more cooperation, a little less politics, and we can get the job done this time.
Joining us now is Pennsylvania Governor Ed Rendell. Governor Rendell, thanks so much for joining us tonight. Really appreciate your time.
Well, hi, Rachel. How are you?
Great, thanks. I got to ask you, you've got a great political compass. You can predict things well. Is this finally the year? After decades, are the stars finally going to align to fix health care?
Absolutely. I think the people in the Senate and the House, Democrats and a lot of Republicans too, understand that Barack Obama was elected to make change, and the primary domestic change that the American people want is accessible, affordable health care that can't be taken away from you when you get sick, health care that can't be denied to you because you have a pre-existing condition. The system needs change. It's broken. The American people want to fix it, and Congress will eventually respond.
There is not a Republican counterproposal on health care policy. RNC Chairman Michael Steele admitted as much today. Essentially, he said that he was there to do a policy-free, pure politics discussion of health care. And given that that's so far been the Republican approach, I understand why they're calling for a delay. The thing I don't understand is why conservative Democrats, some conservative Democrats, are also calling for a delay. Do you understand that?
Yeah, I do in part because I think there are a lot of conservative Democrats who are afraid of exploding deficits. And the prediction from the CBO is something that makes everyone step back and say, wow, how are we going to pay for this? I think the proposal to tax the top 1% of people in America and pay for health care that way and pay for health care by the cost containment that the president wants to put in place are very reasonable and something we all should support. But I'll tell you what one of the problems is. It's the way the CBO scores things. There's no doubt in my mind from our own experience in Pennsylvania that you can do cost containment and cut costs. And let me give you just one example. In Pennsylvania, we passed an aggressive law to police hospital-acquired infections. Hospital-acquired infections were killing 2,500 people a year in Pennsylvania, costing in charges to the system $3.5 billion. In just 1 year after the law, we reduced hospital-acquired infections by 8% and cut $358 million of charges out of the healthcare delivery system. And that's just one of 20 different ideas to contain and cut costs. So we can cut costs. I don't know how the CBO scored it and said there are not going to be any cost reductions from the Obama plan. I think the Obama plan will cut costs dramatically. We're going to find out that it's far more affordable to do this than anybody thinks.
The argument from the Republican side has been not that there is some way to reform health care that's different than what the president and Democrats are proposing. Their argument thus far, and it may change, has this boiled down to we have the best health care system in the country. Stop whining. Why do you want to mess with something that's working so well? Do you think that that's going to be the plan they stick with? It seems to me that has to change.
Yeah, and I don't think that washes with any of the American people. And the statistics are pretty clear. We have the most expensive healthcare system in the world, but in things like infant mortality, cancer rates, things like that, things that govern wellness of a people, we're in the mid to low teens. We're 15th or 18th or 19th. So we're spending the most, and we're not getting the best return on our investment. Far from it. So this system has to change. Look, do we have the best doctors and hospitals in the world? Of course we do. Of course we do. And we should be proud of that. But the system needs changing. The system can contain costs, very common sense ways of doing it. And there's no excuse for the richest country in the world to have 47 million Americans without health care and another 30 or 40 who have inadequate health care that drops them if they get cancer, for example. That's unacceptable in the U.S. of A. in the year 2009.
Pennsylvania response to Senator DeMint today that this isn't about him, it's about fixing a healthcare system that's broken. For Republicans like Jim DeMint, who has received nearly $3 million from the healthcare industry in just the last 5 years, what is this about if it's not about maintaining the status quo for the healthcare industry?
Well, I've got to say, David, I was over at the White House briefing, and then I spent the rest of the day talking to Republicans, and it was like I was shuttling between parallel but not overlapping universes. People like Jim DeMint and other Republicans in the Senate and House, I can't overstate their fear and dislike of Barack Obama and everything he stands for. In their view, Barack Obama is trying to engineer a government takeover of every aspect of private enterprise, whether it was in the stimulus package, cap and trade, and now health care. And Jim DeMint is proud of what he thinks he stands for, which is private sector dominance over health care. Politically, that's very unpopular, but he doesn't care.
Well, if President Obama's effort at health care reform were to fail, would Jim DeMint and the Republicans really win by essentially keeping the status quo, by knocking it down? I mean, would Americans be likely to look at Senator DeMint, even in his own state, as having achieved anything for them? I mean, how hollow would the victory be?
No, I think it would be pretty hollow. You showed the poll numbers on the public's basic trust of Democrats over Republicans on health care. The fact is that most Americans want health care reform. They know the system is broken. They want it to be fixed. They want coverage extended to all. Most Americans, if you ask them just on this question, they say they think there should be a government guarantee of health care for all. So it would be, I think, a Pyrrhic victory at best. I don't know whose Waterloo it would be if health care
Are the Republicans
goes down.
smart to have people like Jim DeMint out there saying, let's kill this thing in its bed, let's kill health care because it's a way to kill Obama?
Yeah, no, it's not smart at all. It's not smart politics. It would appear that that's the only thing that some Republicans feel that they can talk about. But there are a lot of problems with the bill itself. And really, if Republicans were smart, they'd be talking about patient-centered health care, what the real problems are with the bill, and what Republicans stand for in terms of health care reform, rather than killing Barack Obama.
Gene?
I agree with Michelle. It's not smart at all. I think the question now is, how does the president take control of this issue? How does he get out in front of it? How does he tell Congress, rather than let Congress work it out?
Turn the pillow over to the cold side. Nobody talks about this. Suppose the Republicans get blamed for killing health care. Isn't there a downside to that?
Yes, there is a downside, because every poll shows that people want health care reform and people want Americans to have health insurance, and this is a tremendous problem for a lot of families. So yes, it's a problem for Republicans. I think one thing we should keep in mind through the next several months is that if it does pass at some point, nobody's going to remember whether it passes in August or in October or November.
But you know you got one window. It's called the first year.
Yeah, exactly. Now, if it doesn't get through the first year, it may not get through.
Do you think they could pass it in the fall, if not now?
Well,
do you think if they slip on this, this is a key question, if they don't get it done, get it to conference committee between the House and the Senate by August, will they have a chance to get it done by Christmas?
Yeah, I think they'll have a chance, but it makes it harder.